The TSS is what we call toxic shock syndrome. Have you heard of this toxic shock syndrome? What's that? It's usually when women are using like a towel and they use it for their menstrual and they put it there and they leave it there, yeah, for like long time. And what's going to happen? It will be infected. Yes. Usually the commonest organism involved here is what we call Staphylococcus aureus. It's called Staphylococcus aureus. Okay, and it leads to toxic shock syndrome. Okay, so a woman comes with a high fever. Usually what's present is that they have a high fever. The high fever and the blood pressure is dropping, then you have to suspect this. If she's a woman, a high fever, blood pressure is low, then you have to suspect toxic shock syndrome. Okay. Okay, another terminology is what we call prognosis. Okay. Usually when you are in the medical record, we have some. First, you take what? The information of the patient, yes? Which is the registration. Yes? Registration includes the name of the patient, the age of the patient, social security number, the insurance information, all this is included in that. Then you take what? The chief complaint. Yes? What is the chief complaint? Huh? Yes, the reason why the patient visits that medical office, okay? And history of present illness is detailed information of the chief complaint. When you go to the detail of the chief complaint, that's called history of present illness or HPI. Okay, after all this, then the doctor will give what? The doctor is doing the physical examination, physical exam. Okay, the doctor is doing the physical exam. And after doing the physical examination, then he can give what? The diagnosis. The diagnosis means the actual decision. The actual decision. Or then he can also give what we call the differential diagnosis. Differential diagnosis. Differential diagnosis means, what do you understand by this? Let's say if someone can have what? Pneumonia. So the doctor may say he has pneumonia. So pneumonia, it can be what we call the working diagnosis, or also called clinical diagnosis. It means he is working on that, but still he has some other conditions in mind. Yes, like for example, it can be tuberculosis. Okay. So he will write like this: pneumonia to rule out tuberculosis. Okay? So it means his working diagnosis is pneumonia. His working or clinical diagnosis. Clinical diagnosis means a diagnosis made because of history and physical examination. After you do history and physical examination, you have a clinical diagnosis in mind. Okay? Then you can give tuberculosis. If you are sure, usually which may not be the case, okay, you remain with that, but you will say pneumonia and I have to rule out tuberculosis. I am not sure if it's pneumonia. It can also be what? Tuberculosis. So 80% of the case I will work on pneumonia, but I go for tuberculosis. Now, to rule out, what is he going to do? to rule out if it is tuberculosis or lung cancer or what's that, what is he going to do? He will send some what? Lab tests, yes? Lab tests and imaging, or anything that helps him or her to get the actual diagnosis. So he or she will send what? Then he will get a confirmatory what? Diagnosis after this. So that confirmatory diagnosis is called medical diagnosis. Okay, so medical diagnosis is a diagnosis made after giving what? Lab tests, or after doing some lab tests. Okay? So after the lab tests, medical diagnosis. Before the lab tests, clinical diagnosis. Did you get these differences? Yes? And after all this, he can give what we call prognosis. Prognosis. So sometimes PX. So that is what prognosis here. In the opinion of the probable cause and outcome of a disease. Okay? Outcome of outcome of a disease means this condition is treatable, or this condition can lead to complications of this and this, and or the patient might die of within these years, and so that's what prognosis. Yes, that's called the prognosis of the disease. So okay, any questions on this? Okay, let's go to the next page, page 9. Who's going next to read?